Okay, let me get going. I'm actually no longer the president and CEO of Irwin Seating Company. I'm retired for about 6 years, but I'm still chairman of the board and very involved in community stuff. I come to you as sort of the connector here between, this research, and Talent 2025 that obviously I've been involved in from the very beginning. I think everybody who's involved with Talent 2020 knows that mental health issues have always been an obstacle in our tapping the talent of our employees. And of course, the pandemic then dramatically increased mental health issues for both adults and for kids. So as Talent 2025 looks at improving learning in our K through 12 system, we should pay attention to youth mental health issues that are on the rise. And then I guess I'll turn it over to Lisa, you and John to talk a little bit about the context, and then I'll introduce the Citizens Research Council and Eric and Tim.
Yeah, perfect. Thanks, Wynn. And first, thank you for bringing this learning opportunity to our attention. And part of our 5-year strategic plan and some of our K-12 innovation work is really very focused on mental health and social emotional learning. And so this is very relevant to some of our goals and objectives and helping engage and have students become, recover emotionally from COVID and then engage academically for student outcomes. And so, John DeWise, I know you're on the call as well to maybe, share some of your insight and some of the work that we've been working on with our K-12 plans.
Yeah, we've been, there's been a good, strong cross mix of different individuals, from the employer community, nonprofit, as well as Talent 2025 and different organizations. So I think it's really exciting to have this group of people here. And, we're realizing that, if you can't read and you can't write, it's a big detriment to learning. And our big focus is early child literacy, especially by the 3rd grade, and of course beyond too. But we also realize if there's a lot of social and emotional barriers in between happening, that's almost like a foundational thing you gotta work on as well simultaneously. And so this work is very applicable to our own, like Lisa was saying, our own strategy in terms of where we're going forward. So like we said, we're more engaged with creating partnerships with schools that are doing this well right now and say, okay, how do we walk alongside you and support you and help you? And at the same time, how do we, kind of the ripple effect, how do we get that going with other schools? So I think it's a really good strategy. It's I think there'll be a lot of legwork, but we're also excited for it. So we got a good group of people working on it together.
Yeah, perfect. Thanks, John.
So I'm going to introduce the Citizens Research Council. You may or may not be aware of them. They've been around for well over 100 years, and they provide facts-based research for the state of Michigan. So we zero in on it. I'm on the board. And they recently published, which is the topic today, their paper called, and that's what they do research papers, and we'll hear from Tim in a minute, but it's entitled Youth Mental Health Crisis in School-Based Mental Health Services. And so with us today are Eric Lupher, who's our executive director, and Tim Michling, who is the author of the paper. And I will let them go through, a little bit of background, and then get into the meat of the matter, which is mental health in K through 12.
Thanks, Wynn. I have a real brief. You still hear me?
We can.
All right, my screen went blank. It was weird. Real brief role here today. I want to thank Kevin and Wynn for this opportunity, and Lisa for all the help that you've provided in putting all this together. The Citizens Research Council is working obviously with public health and health issues such as this, also working on issues of education, finance, local government, state finance, things like that. So I encourage people to check us out at crcmich.org, crcmich.org. And with that, let me turn it over to Tim.
Thanks, Eric. I appreciate it, and thank all of you for tuning in for this presentation this morning. It's honestly my first time in over a year speaking to other human beings before my morning coffee, so I will do my best. This is just a little about me that we don't need to get into, so if we can go to the next slide. As was mentioned, we've looked at the youth mental health issues in Michigan, and there are a variety of ways to approach these, but among them, there are several school-based approaches and models that are especially promising. So the paper primarily focuses on those. Next slide. Next slide again. So within the national context, we've heard a lot in the news about the impacts of the coronavirus pandemic on youth mental health. And when we look at the data, mental health conditions and other behavioral health disorders are highly prevalent among young adults and children throughout the United States. And at this point are the most common illnesses that children face. Something important to note is that this is, we do see effects from the pandemic. We also in the last year and a half see effects from other social, economic, and political happenings in the nation that have an impact on youth mental health. But this is a trend that started long before the coronavirus pandemic. Next slide. So nationally, if we look back just a little over a decade, we can see an almost doubling in the prevalence of major depressive episodes by young adults and children and adolescents. And so this is a concerning trend to see this sort of increase over time. This tells us that it's not just an increase in diagnosis because there aren't major changes in diagnostic techniques that would account for this over this period of time. And it's not any single cause. If you think about these numbers looking in 2008, if we're talking about 18 to 25-year-olds or 12 to 17-year-olds, we have to think about all the events in the late 90s, in the 2000s, everything in the life course of these individuals that would add up. So there are certainly genetic factors, their experiences, traumas, stressors, and social changes and all of these factors. Next slide. Just as we've seen this nationally, we see the same thing in Michigan, and actually the trend in Michigan is more severe than what's experienced in the nation or the Great Lakes region as a whole. The proportion of youth in Michigan experiencing a major depressive episode has increased by 83% since 2007. And that's only for the most recently available data. And so I think once we get accurate and reliable data for the last couple of years and the COVID pandemic, we'll see, a much higher percentage than that even. Next slide. Suicide is a complicated phenomenon, and it's not a one-to-one association with things like depression or anxiety disorders, other mood disorders. But the presence of these disorders, as well as substance abuse disorders, does increase the risk of suicide. And what we see is really a disheartening trend of suicide rate increase among persons aged 10 to 24. And again, this is a national trend, but when we look at the data, it's more severe in Michigan. And in around about 2009, 2010, we see that Michigan went from being below the national average to above, and that has continued for the subsequent 10 years from that data point. Suicide is now the second leading cause of death for people aged 10 to 24 in the US and in Michigan, surpassed only by motor vehicle fatalities. And when we understand this, it's not merely an individual phenomenon. It is associated with individual experiences and some of those mood and anxiety disorders, but it's also associated with societal factors. the availability of social support, the social cohesion within communities, and trust of neighbors and other individuals, the availability of services and treatment, and our individual and societal attitudes that may inhibit people asking for help, like when we tell people to just tough it out, and the stigma associated with either suicidal ideation or other behavioral health disorders. Next slide. So let's look a little bit at the behavioral health treatment context. In Michigan, there are a few ways to look at this. We can look at health professional shortage areas, which are designations by HRSA at the federal level. And we have quite a few of these in Michigan, with around 42% of our population falling within a designated health professional shortage area for mental health. Within those shortage areas, it's estimated that only around 28% of the need is met. So there's substantial added need for health professionals and access to behavioral health care. Next slide. If we look at the total number of behavioral health providers, so this is psychologists, social workers, various types of counselors, as well as psychiatrists and nurse practitioners specializing in psychiatric care, we can create a ratio with the population, and we see really stark differences throughout the state. 8 of our counties actually do quite well and fall above the 90th percentile nationwide for the proportion of providers within those counties. Kent County being one of the 8, along with Grand Traverse County and Kalamazoo County over on the west side. Statewide, we do okay, actually, with about 1 provider for every 360 citizens. Okay is relative, but as you can see from the map, there are lots of areas, particularly in northern Michigan and in more rural parts of the state, where there's a complete dearth of providers and other issues with access. Next slide. Specifically on the medical side, if we look at child and adolescent psychiatrists, we have a major shortage really in the entire state of psychiatrists in general, and of child and adolescent psychiatrists with that specialty in particular. Washtenaw County is the only county with a mostly sufficient supply, and that number belies the fact that people from Livingston or Wayne or other counties may come to Washtenaw County for care, and that of course will still create pressure on the availability of services for folks living in Washtenaw County. But throughout the state, there are many counties, more than half in fact, where there are absolutely no child and adolescent psychiatrists. And if you look up in the northern part of the state, it looks like maybe Presque County surprisingly is doing well, but that's because that's at the point of these data, there was 1 child and adolescent psychiatrist located in that county, and because of the small population, the ratio looks better than maybe it is. And when we look at statewide, actually 62% of child and adolescent psychiatrists are located in just the 3 counties of Washtenaw, Wayne, and Oakland. And there are an additional 15 in Macomb County, which would inflate the number to almost 70% if you included that county. Next slide. Now, the provider shortages and maldistribution are a big problem, but even if we were to snap our fingers and magically address that, we would still have a lot of barriers. There are structural barriers like transportation in rural counties or in our urban areas that allow people to get to providers. Insurance coverage, waiting times are an issue now. They might be less of an issue if we had a higher provider supply. But there are also some of the social barriers that I began to mention, like stigma, as well as information deficits and our norms and values of when we decide it's appropriate to seek treatment and for what cases and symptoms. And so it's really important that we continue as a society to recognize that mental health issues are health issues. just like any other health issue. And they require both professional treatment as well as empathy and support from the community. Next slide. So, next slide again, I apologize. I mentioned that this paper focuses predominantly on schools. It's worth asking why schools? And there's a really strong association, as many of you probably know, between education and health. When we look at people's long-term health outcomes and life expectancy, those are highly correlated with their educational achievements. And on the other side, our success in education is highly associated with health. And so health-related barriers to education can really be strong predictors of students failing to matriculate, student attrition, and student struggles within the classroom, both academically as well as behaviorally. Next slide. Michigan has a particular lack of school health professionals. And when we look at the ratios of social workers, psychologists, school nurses, counselors, we don't do particularly well either compared to the national averages, and especially not compared to professionally recommended ratios. Next slide. We also have a model of school health that are school-based and school-linked health centers. There are about 200 of these throughout the state. Kent County, again, does very well in this regard in having several of these, as do some counties in Southeast Michigan. These are basically health centers that have some sort of medical affiliation, either with a health system, with a federally qualified health center, with a local health department, that are located on school grounds or in some way linked to a school, that provide primary healthcare services as well as behavioral healthcare to students. And so this can include psychosocial counseling. And in the case where students need higher levels of treatment or more complex treatment, school-based health centers can facilitate that by providing referrals to external providers. And what we find in the paper is that there's really a place both for your traditional school nurses and social workers, as well as school-based health centers, to work in tandem, where you have school health professionals focusing on the health of the entire population of the school, whether that's infectious disease control, which has come back onto the radar with COVID-19, or looking at population-based interventions to improve school climate and prevent mental health disorders or other health conditions before they emerge. And that prevention focus, I think, is really important, but then also identifying when problems start to emerge so that treatment can be offered earlier rather than later. And those roles really work in tandem with having a health center that's conveniently located and that has some of the payment and paperwork and appointment issues already worked out to increase convenience for students and families. Next slide. We can see in the Grand Rapids area specifically, there are a number of school-based health centers with several different medical sponsors. And while these have traditionally focused on low-income communities, our report finds that this really is a model that tends to improve student health and improve educational achievement in schools that have school-based health centers. And so it's something worth considering, really, I think, for all school districts. Next slide. And there are a lot of other strategies in schools that don't focus specifically on treatment, social and emotional learning being one of the major ones. And Michigan now has standards. We're seeing more school districts adopt these, but there's still a lack of consistency. And so we have an incremental approach in general in public policy and in government, whether that's at the state or local level, and whether that's in other areas of government or our public schools specifically. My admonition would be that the scope of the crisis or epidemic that we're seeing with behavioral health conditions warrants more than an incremental response to get ahead of the numbers. It's also important that we provide training for educators to have trauma-informed practices, to understand referral systems, to understand the issues they might see, and have the professional skills to address them, ideally in tandem with trained health professionals within the schools. And at the population environment, obviously there are lots of school environment interventions that we can do to prevent bullying and discrimination, to actively destigmatize mental health issues, and to support the things that improve student wellness, like school art and music programs, extracurricular activities, nutrition, and sports programs as well. Next slide. And with that, I will turn it over to questions. Sorry for the length of the presentation.
Perfect. Thank you, Tim, for that in-depth analysis. And so at this point, feel free to unmute yourself and either comment or have any questions for Tim. And if you prefer not to speak up, you can also send me a private message if you want to remain anonymous. But we have a few minutes for questions and discussion.
Tim, my name is Mike, and I just wanted to, first of all, thank you for this presentation. And I really applaud addressing these issues. I happen to be on the board of directors of a nonprofit organization called Erica's Lighthouse. I don't know if you've heard of Erica's Lighthouse before, but Erica's Lighthouse provides, this past school year, we served 558 schools in 43 states and 6 countries. And we provide a high school education program. We provide a junior high program, and we're just about to launch an elementary school program. And all of these programs are intended to do what you said, to create awareness to all students. In fact, I can think of one school in Dearborn, Michigan, that it was launched at this last year, where the high school program was taught as part of the 9th grade health education course. And the whole idea was, you know, an individual might not be suffering depression, but might know a friend that's suffering from depression, but doesn't know what it is. And the whole idea is to create awareness, so that the stigma, as you talk about, can be broken, so that we can get depression out of the dark, and then be able to get help to parents and to students and to the schools themselves. I guess my question is so with that backdrop, my question is in terms of our reach here in Western Michigan. Is there the thought process of having sort of some sort of an organized approach, you know, with the schools to provide this type of education?
I might turn that over to Kevin to talk about what organized approaches there might be for the business community. But I would say, obviously, there's a professional role for response and a community role. And so when you see something like a school-based health center opening, the business community may not have an active role in the nuts and bolts of opening that, but in supporting the idea for and championing the message of the value of school-based health. I think there's certainly a role. I would also say that while we can intervene in school districts, that's not the only place that students exist. They also exist in households, they exist within families. And so anything that an individual business does for its employees to work on destigmatization, those are also parents and also community members. And so I think that has an impact as well. Our paper in its scope didn't look at specific avenues or strategies for what you're talking about, but I think there could be good ways for that to happen. I just don't have that answer right now.
Yeah, no, and I thank you for that. And I might, Kevin, if I'm off track in terms of where I'm asking the question, just please let me know. I would just only say that I would love to be part of some further discussion on this, especially thinking through some of these issues. And I would love to introduce, this committee or some selected group of people to the fine folks at Erica's Lighthouse, because again, that's the other thing to mention, is that these programs that Erica's Lighthouse provides are entirely free. And it was a very interesting storyline. The parents of Erica took her own life 16 years ago, and her father was an attorney. Her mother was pretty well to do. They had 3 children. Erica was the youngest, and associated with, her suicide, there were no resources to educate adolescents and parents going through this terrible thing. So they made it their life's mission 16 years ago to create Erica's Lighthouse as a beacon of hope for adolescent depression. And they canvassed all their friends and people in the community to get funding. We have fundraisers every year that fund entirely the programs. But Tom and Ginny are the parents at the time. Their 2 older daughters were at the University of Michigan, and they initially reached out to the University of Michigan for resources to support their older daughters. And ultimately, what was born within 5 days of Erica's death was the beginning of Erica's Lighthouse. And like I say, now all these years later, over 500 schools in 6 countries and 43 states in the U.S. And these resources, I've been looking for an avenue to be able to provide, access. And if there's an extent to which it's appropriate to be part of a committee here, I would love to make introductions, and I would love to do outreach, because at the end of the day here, the kids can't help it. Everybody deserves to be happy. And having been a several-time CEO in my career, there's no question that mental health in the workplace is ultimately the result. But in my opinion, the time to start addressing this is through the school age, so that the conditions can be built to cope with anxiety and depression and this type of disease. So I sorry for taking up so much time, but if anyone wants to talk about this, please reach out either directly or through Kevin, because I'd be very
Yeah,
well.
hey, Mike, I think since you and I had talked briefly about this I think was kind of this entire session as a way to prompt sort of a focus and begin to organize. And so most definitely I'd love to take you up on your willingness to be a part of any sort of committee we form as a result of this, because this is within our K-12 plan. And then to get connected to Erica's Lighthouse would be most helpful. Tim, I just interjected. Mark Petz had a great question in the chat window that maybe you could address in terms of the impact of mobile devices, social media on youth mental health. Some of you might have seen the show, the Netflix show, The Social Dilemma, which had a lot of really compelling data related to Mark's question. So could you speak to that?
Yeah, absolutely. I also saw a question from Casey that I'll address really quickly. The rise in diagnosis, is that associated to decreased stigma? I think that can be part of it, that people are more willing to seek care, and we see less stigma today than 20 years ago, but still more than we'd like to see. At the same time, that doesn't account for all of the data, and that wouldn't explain, for instance, the increase in suicide rate. That's not based on seeking treatment, but rather based on other death records and vital records. If you want to email or call me individually, my contact info was in the presentation. Happy to talk about that more. On the mobile device issue, yes, definitely there's quite a lot of research. Our report doesn't go into this specifically. We were taking more of a broad view on the incidents and the factors and looking for some solutions. Obviously, addressing root causes is important, There's a variety of studies that look at the impact of mobile device use, which can have, an individual deleterious effect for some youth, but also magnifies other social factors. So where we saw bullying and things, those have always existed, but when you have a mobile device, those follow students home and they have, easy access to that. It also, we know with social media, that creates a distorted image of individuals and their lives, and it can amplify the good, it can amplify the bad. I don't think that mobile devices are the only cause. Like I said, I think it's a complex, multifactorial issue, but every single piece of it that we address can certainly improve children's well-being.
Just one quick thing, Kevin, the Mental Health Foundation locally, also called the Be Nice Foundation, is a resource for all the schools and really the whole community on mental health issues. And they've been very proactive in West Michigan because that's where they're centered, but also throughout the state of Michigan. But if you're looking for resources, that's another one that you may choose to introduce your schools to, or your company, because we've actually looked at some of the stuff they're doing for employees, and it's really, really good. And it's not costly, which is kind of important for us business folks.
Yeah, I would add to my previous answer, and sort of thinking about the work that the Be Nice Foundation that they do, that with something like mobile devices, it's a question of, can you really roll back the technology, even if it's a contributing factor, or how do you mitigate the damage? And so when you look at social emotional learning and other interventions that prevent some of the negative aspects that filter through mobile devices and social media usage, that might be a more practical strategy, although certainly individual families can make decisions for their children and how they access devices. And I think parent education is really important in that regard.
Very good. I'm just looking at the chat and I don't see any further questions. And I know we're a little bit past our time, but I feel as though if you have other questions, I will definitely follow up after this presentation. Some were asking for the presentation, but Tim, if it's okay, if there are additional questions that do come after, that we provide your contact information for those questions, if that's okay.
Absolutely. I see one more came in and I'm happy to address that offline to respect everyone's time. Please feel free to contact me and use myself as well as my colleagues at the Citizens Research Council as a resource. I'm happy to help in any way that I can.
I appreciate that. I appreciate that. And I will also follow up, I think, Mike, and have a conversation about putting a group together to be introduced to Erica's Lighthouse and some of that work, and see how we can help engage our schools with their programming too. I think that would sounds phenomenal.
That would be great. And I also want to learn about Be Nice, because I've only been in the community, half a dozen years. And I became through family acquainted with Erica's Lighthouse, but I'd really like to learn more about Be Nice. So thank you for that.
Yeah, definitely. Very good. Well, thank you, Wynn, again, for this learning opportunity and bringing it to our attention in the forefront of our work, and particularly in K-12 education, and supporting our students and their educational outcomes and success in life, and the important conversation that we need to destigmatize, Tim, and I appreciate that comment very much, and appreciate your time and research and everybody's time this morning, and I will definitely be following up shortly later this morning. Thanks so much.
Thank you.
Thank you. Thank you, everybody.
Thank you.